First of all, I just want to thank President Ferrer again for hosting us in your beautiful country. As Michael said earlier this morning, it's our first time in this country, and hopefully this will be just the beginning, and we'll be working closely with all the stakeholders here in Sri Lanka to help individuals and families with autism have a brighter future. And I also just want to just emphasize that for us, the experience of working in a new country is always a educational one. And I know there's a lot, not to say that, bring some information here, but I think as Michael alluded to this morning, we see ourselves as really facilitators, and we're here to serve you and the larger community. And we have resources and content expertise we can bring to the table, but we want to do it in a strategic and focused way. And in order to do so, we need to understand what your needs are and how we can be helpful to you. So the presentation this morning has been for me, very educational. It helped me understand a little better about the challenges that you're facing, and certainly some of the challenges we've heard elsewhere in the world, but some are also very unique in Sri Lanka. And I think Michael and I both very much look forward to work with all of you in the coming days. Again, just a start to really try to get a handle on the scope of the challenges here and better understand how we can be helpful to all of you here in Sri Lanka. So just a refresher of this slide that Michael showed. I haven't updated from 4350 yet, but we are indeed in over 50 countries now. So what I can do is, first of all, give you a little narrative about how Autism Speaks and the whole global autism movement really kind of developed. And there could be some specific examples that we're doing in some countries, the strategy we've used to develop resources and opportunities in these countries for our families. And some of them may be of interest to the Sri Lankan community. Some may not be. The idea is that I want to share with all of you some of the options, the type of activity we engage in, and how they're varied, but they're really a different path to the same goals. And I think that's the really thing I want to emphasize here, is that I think, at the very core of the issues here, the global community, as Michael alluded to in his presentation, really shares a lot of common challenges. But how we get to the solution is very much dictated by infrastructure, capacity, culture, community in which we work in. So this is, again, where we need you to teach us how to be helpful to you. So many of you know the World Autism Awareness Day is obviously an important event for our community worldwide. Since its first World Autism Awareness Day in 2008, it's become a rallying cry for our families around the world, not to pay attention to their own plight, but also to get a sense of solidarity globally, that no individual, no families are really alone, and that there's a global community that are facing similar challenges and trying to find a problems. And there's really an opportunity for us to learn from each other, so that we don't repeat the same mistake that other people may have. We may have to be able to explore ideas that we have not thought of, that we don't have to work elsewhere. But I'm not sure how many of you know how the World Autism Awareness Day came about. It really actually started with a trip by our co-founder, Suzanne Wright, to Qatar in 2007. And this is when she met Sheikh Moza, the wife of the mayor at that time. And in about a 15-minute conversation, Sheikh Moza is really a true visionary. As you know, has done many things for education and the children in her country, Qatar. In a very brief meeting with Mrs. Wright, they decided they have to do something significant for the global community. And soon thereafter, her mission of Qatar, the United Nations, started to work on this resolution for World Autism Awareness Day. Autism Speaks provided some technical support and some content support as well. But really, they led the way and passed this resolution that many of you all of you are familiar now with. And that really begins, I think, really the new chapter in terms of the autism movement around the world. But for us as an organization, lots of interstate really was the first step. We see it as a leverage, as an opportunity to develop a set of strategies around this occasion so that we can advance the causes, advance our mission, and to address the needs globally of all our families around the world. So what we did is basically create an issue-oriented global brand. And we provided, so the logo you see here, you've seen in many countries now. We offer it for free to all communities around the world. And this in itself enhances awareness and builds solidarity among communities around the world. We use social media extensively, social marketing extensively. So lots of media coverage. The fact that our co-founders were for the media world certainly helped. But we also use Facebook, Twitter, and Light Up Blue. Right now, our Facebook, for example, has almost 1.5 million people on it now. So it's really a powerful platform for us to disseminate information and just solicit feedback for ideas from our families around the world. And of course, Light Up Blue that Michael talked about has really become an important rallying point for our global community on an annual basis. So really what we're talking about is trying to develop a strategy both on awareness and mobilization. But just knowing that there's a challenge doesn't mean that you're going to end up with the solutions that are meaningful. And so as an organization, what we're trying to do is forming the strategy by providing activities such as youth funding for research, country level regional facilitation, in partnership with various UN agencies. Like I said, Light Up Blue now is occurring every April 2nd, and it was launched in 2011, so it's only a few years ago. But it really has taken on a life of its own over the past couple of years. Basically, the idea is to light landmarks, buildings, offices, homes, and even individuals wearing blue shirts, and their faces blue. And it just is an activity to demonstrate, they call attention to needs. And actually it's a media magnet, right? Because the media will say, why is everybody blue? Or why is the building blue? And that creates an opportunity for families and professionals to educate the media on what autism is and why there is a autism awareness. So it's a show of global solidarity and certainly enhances professional and public awarenesses. And we hope that you'll be able to join us in 2014 for Light Up Blue. We'll be happy to provide more information if you would like that. So we work at a country level, typically serving as advisors, technical advisors for ministries and at times for as a state. And like I said, every country, even though they share similar priorities, similar needs, in terms of how they solve them, the path that they take to the solutions are a little bit different. And what I'd like to do in the following slides is show you some of the countries in which we worked in and how they all kind of take a different path to a similar solution. And it's also noteworthy that not all these countries have a lot of resources. Some of these countries have very limited resources. But at the end of the day, what made the difference is really the will to make a difference. It's not about money, because we can always find solutions that are cost-effective, that doesn't require a lot of resources. But it's really about being innovative and trying to come up with opportunity strategies that best fit the conditions on the ground. Albania, as you know, is a small country in southeastern Europe. It's also been one of the poorest countries in Europe. But the leadership there recognizes autism as an important public health initiative. The Prime Minister has actually told us that the Prime Minister is formerly a cardiologist, and so he understands the medical issues. And he said that he felt like he missed the boat on thalassemia when it was an issue, but he didn't have little courage at the time to address the issue by issuing social policies. And he didn't want that to happen again with autism. So he was very aggressive, along with his wife, who's a pediatrician, to push the autism agenda forward. So Albania is actually one of our first partners when we launched the Autism Health Initiative in 2008. We held a national conference in 2009, started doing a professional training pilot in 2010. And in 2011, they built this beautiful state-of-the-art center right outside Toronto. I have to tell you, it's something to be seen to be believed. It's really, from my perspective, even a lot better than mid-century seat in the United States. So what it has become is kind of a national resource for the community of Albania. as well as a regional resource for other countries in the region, something to aspire to, something they can use as well for training and other purposes. And then this year, last year, we started a program there in Albania, training parents so that they can start to deliver some intervention, evidence-based approaches in their home with their children. In Bangladesh, many of you know, that happened actually very quickly. Through a conversation with Saddam Hussein, the Prime Minister, there was a launched campaign in 2010. A regional autism conference there, and you see in the middle picture there, First Lady Ashraf was there, along with Sheikh Hasina, and then of course Mrs. Gandhi from India. And in 2011, an MOU was signed between the Ministry of Health of Bangladesh and India over this issue to collaborate. A situation analysis and an action plan was generated, and Michael actually led to facilitate that process with the National Advisory Committee. And the President accepted the recommendation in 2012, and the Interministerial National Autism Community Committee, which included health, education, labor, and so on, came together so that their approach to the issue can be coordinated. I heard earlier today about the lack of coordination. I just want to point out this is very common, right, around the world, in all the countries where government is seen. Because frankly speaking, not many government have really dealt with the issue like autism or development skills in general. And there's a recognition now in order to have an effective and meaningful solution, all the sectors have to work together. Now, how do you get these ministries to work together? You said it's a different issue, and we'll have different solutions in different countries as well. China is another example where things happen very quickly. As you know, China is about fifth of the world population. In 2011, we held a national conference in Shanghai. We launched a collaboration with the large leading children's hospitals in China in 2012, the Children's Hospital in Shanghai. And also later in 2012, at the invitation of the Ministry of Health, we became the technical advisor to the national project that was launched by the Ministry of Health, where they, through a network of children's hospitals, 8 children's hospitals in the country, started a capacity building program. We started training professionals to do screening, diagnosis, and intervention, and then to leverage that expertise to initiate the first ever national prevalence study. So this project, we're about a year into this project right now, is doing very well, and so we're excited that a country like that, in China, has come up with a solution to address the needs of those people. And in South Korea, you heard about the alarming statistic that Michael was talking about this morning, 138 in South Korea. We believe that's a very robust study methodologically, and as a matter of fact, we're actually replicating that methodology in the U.S. We see that if we're actually indeed undercounting some of the children in the United States. So Kim et al. Is a prevalence study up in 2011. 2012, we formed a partnership with the Society of Korea with our parents. But they're very influential, they're connected, they're talking with the government, so it was a good way for us to integrate our efforts into what's going on in South Korea already. Last month, actually 2 weeks ago, we were just in Korea, and we had a Gap in Korea conference where for the first time, multi-sector and multi-ministry came together. They actually formed what they call a National Autism Advocacy Network. It's a private-public partnership. So parent organizations, ministries are engaged. They come together to talk about issues and challenges, try to come up with consistent solutions. And Autism Speaks is very proud and privileged to be part of that process of facilitating the interaction and providing assistance when it's needed. So the lesson in South Korea is actually very interesting because what it is that we started with a prevalence study in South Korea. We learned something about that community, the culture. During the break, I was talking to Professor Pereira about the importance of parental expectation, of culture, in dictating what a solution is appropriate for a particular society. By understanding some of the issues that we encounter during the Korean prevalence study and how embedded in the culture those issues are, like stigma, and how does a family react to the news of a child being diagnosed with autism, and what are the parental expectations of successful child development, in African culture. It varies, right? I mean, so what the parents expect, successful child development is in in Bangladesh, we very different from Sri Lanka, very different from the US, and in South Korea. So having that cultural understanding is very important. So this is where GAP and early access to care that Michael mentioned earlier this morning really kind of come together. And it's really about going beyond the borders of just countries or even parts within the country. So just to illustrate to you the similarity between early access to care and the Global Public Health Initiative, you know the GAP features already, but for early access to care, it's also to enhance early diagnosis and prevention, specifically in underserved community in the U.S. It's community-centered, and we focus on delivering both short-term and long-term benefits to the family. Because oftentimes when you do scientific research, it can take a long time for anything of substance to come out. And it's not a criticism, it's the nature of the process. And for families, they need solutions now. So the challenge for those of us who are working in the community in the situation is how do we deliver tangible, meaningful benefit to families now while we work on something larger so that eventually you can change the system, change the opportunities that are available for these families. And then, of course, we're leveraging our existing scientific investment in our diagnosis, which is the BSRC, and Babysitting Research Consortium that we have in our convention with the Chronic Treatment Network. These are cutting-edge research that we're supporting at this point. We're trying to take the lessons learned from this research and making it work in a real-world setting. So that's very much what we do in GAP as well. So just to give you an example of what an early access to care project is. So as I mentioned earlier, we learned something from our experience doing the epidemiology study in Korea. And one of the investigators, Dr. Richard Greenker, is actually a cultural anthropologist. He has a daughter on the spectrum, and his wife is Korean, speaks Korean. So he really has a lot of insight into the Korean culture in terms of expectation of child development and the view on disabilities in general. So he took the lesson that he learned from the epidemiology project in South Korea and tried to apply it here in the U.S. To help the Korean American community in the United States to have a better access to care. And it's really to understand the cultural and structural barriers or effect access to care by leveraging lessons learned from Kim et al. Provide appropriate solutions for lowering age of diagnosis and early increasing access to early prevention services, and of course the evaluate success as we go along. So the phases it comes in several phases, and number one is understanding barriers, and these are actually publications that are available. So you're welcome to I'll be happy to provide them for you if you're interested. So we did extensive literature review in Korean languages to understand the child development literature in the country. And then we held community stakeholder meetings. That means we bring together clergy, parents, social workers, physicians, anyone who may have a piece of the puzzle to talk about the challenges from their perspective. We do a lot of qualitative interviews with caregivers and parents to understand, what are the unique needs in this community. And then we take existing materials like the CDC Learn Design Act Early, which is an early which is an awareness tool that the CDC has put out. And Autism Speaks also have what they call a 100-day kit, which is a pamphlet or a toolkit we developed for families, but just learn about their child diagnosis. So really explain what autism is and what they can expect and what they should be doing and what are some of the resources available in the community for them, that are available for the community for them. But what we did is that these materials were developed for, and this is not to say in any derogatory way, we know that 100-day kit that developed Autism Speaks were largely for white middle-class families. Okay, so it's probably not going to translate or as well received by a community of different culture. So we try to take the lessons we learned from the interviews, these literature reviews, and then to adapt these materials so that they're better fit for that particular community. And the reason for that is that we want to make sure that these tools become owned by the community. So we actually have community advisory committee members help us review the material, provide critiques, encourage us how we can make changes, make a difference. And then we disseminate these materials into the community and see if we can be able to achieve an effect. So we held community focus group, we met with media, we talked to church, clergy, went to churches and talked to church leaders, and by establishing a community advisory board and implementing a strategy for disseminating material information, and then we conduct interviews, trying to understand what do the stakeholders know, and what did they learn from the intervention that we introduced community, and what did you do as a result of what you learned, right? Because it's a big difference from when you learn something and we take that knowledge and do something. And we want the stakeholders to act, not just to know, but to act. And how does your health system behavior change because of that? So this project is almost ended now, and we're expecting publication early next year, or mid-year next year. But what we have learned from this process is actually very similar to what we learned from the GAP. Is that it's important to engage community and to have inclusive collaboration. Because all perspectives are important. What you need to know is what you want to do is develop a solution that really have the most profound impact on as many people, as many families as possible within the community. We know that you need a multi-pronged dissemination strategy. So it can't be just from, let's say, the media. It can't be just from the churches. It needs from all the stakeholders that are engaged. We need to collect data as we do these things, so we know what's working and what's not working. And we have to think about how to sustain this in the longer term. So these are all the things that we're trying to solve right now in this small effort. But we believe that lessons learned from this can be replicated across different communities, at least in the United States. So going back to GAP a little bit. So we talked about country level facilitation and how the country level work can inform the work that's going on in the United States. But we also try to work on a regional level because we take advantage of the shared cultural heritages. Sometimes the shared languages are very non-regional in a certain region. So the first regional network developed is South European Autism Network, or SEAN. It was established in 2010 in Tirana, and 8 countries are involved at this point. And the country coordinators were appointed by Ministry of Health. There's an annual meeting for sharing information and progress. And now we actually launched the first network project last year. And it's really trying to do a family survey. It's hardly, maybe not so hard for you to believe, but as far as we know, none of the government in the South European region actually understand or know what the parents need, right? So actually going out to the community, trying to do a survey. I mean, it's a rigorously designed survey. So we have some sense in terms of what are the priorities of the family. Are there shared opportunity across the 8 different countries? And what are the major differences? And this will help governments and all other stakeholders develop sensible policies going forward. I think Bangladesh is a similar effort. So the song, as you know, the Dhaka Declaration was a result of the meeting in Dhaka. 8 countries are now engaged in the song. And again, this is under Michael's leadership primarily. Country coordinator appointed by Ministry of Health. Annual meeting, share information and resources. The most recent one occurred in Delhi, India. And there's a national network project now that focuses on capacity building. For the network. United Nations, we have done a lot of work as well. After the Ross Awareness Day, we held an annual panel discussion on Ross Awareness Day in the United Nations. We bring experts as well as individuals on the spectrum to share their experiences with UN officials and stakeholders. And this is an opportunity for to educate officials about the needs of the community. I like to think that this has had a positive effect on the community, and which led to the more recent UNGA resolution on autism tabled by the state of Bangladesh. We also have what we call the World Focus on Autism event, and this happens every year around September, where UN General Assembly meet. We invite the first spouses of the world's leaders to come to an event once a year to learn about autism, and we ask them for their support, for their help in their own country. As you can see from the upper one, the First Lady of Sri Lanka was there. I think she was with us actually this year as well as 2 years ago. So she has certainly been very familiar with this issue. And I have to say that this has actually been a very effective mechanism for us, and we have established many, many partnerships at the country level because of this event and support of first spouses. At UN, we also work with various agencies. We tend to support a broad spectrum activity around mental health or at least domestic stability in general. So it's not often focused per se. That's because we understand that oftentimes the most effective and efficient way to achieve some kind of answer for our family is to work on a broader basis. But we do focus on awareness and advocacy, capacity building. Field trials is a good example. Right now we're supporting 3 field trials around the world, taking WHO's image gap materials and trying to see how they perform in the field, and then collecting data and revising it. And one South Africa, Sri Lanka, Lesotho in Africa, and then Panama in South America. But we also have activities in Serbia, Bosnia, Vietnam, Bangladesh, and India, working not just with WHO, but UNDP and UNICEF as well. So all these has really generated momentum at the United Nations, enhanced awareness of the United Nations, so that last year, last December, a year ago actually, the state of Bangladesh tabled a resolution, the second in history of the UN on autism. It was very well received. My understanding is that typically such a resolution gets about 30 or 35 co-sponsors. We end up with over 70 co-sponsors with our resolution. So I think it demonstrates that the level of awareness at the United Nations level and the kind of political energy that's out there supporting these kind of activities going forward. And I think that encouraged the development of the World Health Assembly Executive Board resolution that we mentioned earlier today. And as Dr. Cesena said, this is the first time in WHO history where they receive actually a directive from the governing body. It's very clear that something needs to be done around the world. And again, this is exciting because even though the executive board of the WHO is only 35 countries, and up with over 55 countries co-sponsoring it, supporting it, so that means they actually gone out of their way to make sure that they voice their opinion about how important this resolution is for from a public health perspective. And then finally, and this is kind of a culmination of a couple years' activity. There's a consultation called WHO, in which Dr. Pereira and her team were involved, and really brought together multiple stakeholders from around the world. The objective of the consultation was to promote sharing best practices and innovative solutions to strengthen the capacities of the country, identify priorities for research and action, and promote the establishment of a global network. And the participants are multi-stakeholders. I think the participants from over 30 countries were involved. Not just autism, right? Economic disability, mental health in general. They all came together to share their experiences. The outcome is actually very exciting. WHO is finalizing the report right now. I just spoke with Sheikh Cesena a few days ago, and my understanding is the final report will be available on the WHO's website for Christmas. And this will serve as further guidance for stakeholders, both at public level as well as private level, about what can be done to advance the cause here. Certainly the opportunities are to enhance commitment of government through such mechanisms as the World Health Assembly resolution, to establish and sustain a global network of stakeholders, which Autism Speaks intend to do to lead the effort. And the idea of generating information and evidence to support action plans and solutions is very important. Because even though I think we talked about that the majority, 85% of the global autism community are living in low and middle countries, we actually know very little about what can be done and should be done for our community in this country. So the idea of having an instrument that is open source, that's freely available, easy to use, is identified as a priority. We need to have outcome indicators so we know that the intervention is successful and work on the community level. We want to have evidence for what type of intervention actually work, right, on an individual level, and certainly the training material to deliver the intervention to our families. These are all identified as opportunities for both community move forward. Certainly, there's a continued emphasis on support at country level, and of course we need to secure the resources available for the sustainable action. So in conclusion, the global autism movement has really grown in the past 5 years or so, the gap that's operating. And really the key to community engagement mobilization is branding, social marketing, high-impact global awareness events, high-impact regional awareness events, UN agency partnership, member state support, community resource development going beyond the borders, right? And then data collection and research, and finally, policy advocacy, development, and implementation. And with that, I thank you for your help, and I look forward to working with all of you so we can develop customized solutions to the community.